Good to have you join me, Dianne. Now, looking at the restrictions being imposed, mentioned some hotspots. Tell us what areas are these likely to affect?
Hi, good afternoon, Sulaiman, and to your viewers as well. Well, the announcement that we had last night was something that had been anticipated, particularly since last week the health minister also held a briefing where he informed the country that we had now officially entered a second wave. And the metric that they used for that was that the cases were above 6,700 a day. And just to give you some context, previously the cases we'd been seeing about 1,000 up to 3,000 cases a day, just 2 or 3 weeks prior to that. So for us to go up to 6,700 was in itself a concern. And then by yesterday, we were seeing over 8,000 cases a day. So amongst the things that have been main contributors to this has been that at the end of the matric year, usually there are these large parties that are held in some of the coastal towns, and they are referred to as matric rage festivals. And what we've been seeing is that those matric rage festivals have actually become super spreader events where large groups of youths meet together, hundreds and in some places over 1,000 of them. And obviously they are then taking the coronavirus back into communities. Now, you asked about the impact that this is likely to have. Obviously, the festive season is a period where we see a lot of internal travel within South Africa. There are a lot of people who work in different provinces, and as a result, during what is usually called the builder's holiday, people return to some of the smaller or less economic provinces like the Eastern Cape, Mpumalanga, Limpopo, and such. And the president has not cancelled that travel, but he has called on people to limit their travel as much as possible. We also know that a lot of the coastal towns receive a lot of internal and external travel. So what it will mean is that there's likely to be less revenue generated in those coastal towns, particularly in the Eastern Cape, where all the beaches have been closed. And of course, a lot of those in the tourism sector have said that this is going to be a major blow to the economies of those small towns.
Now, going by what you've just highlighted, it then means first the people are aware of the enormity of the dangers of, having physical contacts. And with these festivals, especially the matriculation we've seen across the country, does it worry any of the citizens on the need for them to abide by the COVID-19 protocol? Because we don't really get to see a lot of people go about wearing face masks.
Well, to be honest, I think it does worry a lot of citizens. But what we are seeing is something that's very similar to what happened in the United States, where a lot of those who were contracting the virus at some stage were youngsters. So the statistics that we've been given is that it's people aged between 15 and 19 years. And there you can see it's that school-going age group who are most likely becoming tired of the virus. However, they are not the ones that are the at-risk age groups. And as a result, those who are being admitted are the older group, those who have hypertension, those who have diabetes, and that's the main concern. There are different kind of levels of adequacy in the healthcare system here in South Africa. So, for example, in the Eastern Cape, where there is a large number of new cases, the healthcare system has been significantly under pressure. It is it's quite a poor province, to be quite honest with you. It's not one of the economic hubs like Gauteng. So it doesn't have a lot of big hospitals. And a lot of the smaller towns have to take their citizens to the bigger hospitals in towns like East London and Port Elizabeth. So there's a lot of pressure on that province's healthcare system. And that's why we've seen the government act swiftly on that. I think what's important to also say is that I think government has now moved to a point where they also want to start sanctioning people for not adhering to the COVID-19 pandemic regulations. So one of the things that we've heard our police minister say, for example, is that if police see people traveling in public transport not wearing masks, that they must actually arrest the drivers of those vehicles. We also heard the president saying yesterday that people should be given fines, that's business owners, if there are people in their businesses not wearing masks, or they could get as much as a 6-month criminal sanction as a result of not ensuring that those protocols are adhered to. So we're definitely seeing a government stepping up those kind of oversight mechanisms to ensure that people are actually adhering to that.
Well, we'll keep tabs on this. Dianne, we'll come back to you in our subsequent bulletins for more update on the fight against COVID-19 in South Africa. Many thanks for speaking with us.
Thank you.